Let's talk about aortic valve disease. Uh, where is the aortic valve located? It's located at the second intercostal space, right sternal border, on the right side of the sternum. You can use that mnemonic ape to man to help you remember the locations. Aortic stenosis. Aortic stenosis is most common in older adults due to calcification of that valve. Deposits of calcium over the years makes it very stiff and less compliant. Other causes can be due to congenital conditions or rheumatic disease from strep throat not being treated properly. In aortic stenosis, the aortic valve is stiff and uncompliant. It does not open up completely during systole, when the left ventricle is trying to push out blood into the aorta and to the rest of the arteries for perfusion including the brain, the coronary arteries, and other organs of the body. Because the valve is stiff, more muscle is needed to push through the stiff valve. This leads to increased systemic vascular resistance, or if you like, afterload. What is afterload? This is the force that the left ventricle has to push against. And because this has increased, the left ventricle will have to compensate by growing in size. That means it hypertrophies. The muscles grow thicker to compensate and match up to the increased afterload. Over time, the muscles weaken and therefore unable to pump efficiently. Also, because of the thickened hypertrophied muscle, there is less space for the blood in the left ventricle. So you can imagine a thick left ventricle, so then there's less space for the blood to accommodate, within the left ventricle. So this leads to left ventricular failure, as the left ventricle now can only push out even less blood to the rest of the body. There will also be backup or return of blood that the ventricle is not able to push forward to the left atrium and then back to the lungs. Aortic stenosis has a classic triad. That means it has 3 symptoms that the patient will present with. I use the mnemonic SAD. So aortic stenosis is SAD. S for syncopal episodes. They will have fainting spells due to less blood flow to the brain. A for angina or chest pain due to less cardiac output and therefore less available to the coronary arteries. They become ischemic. And then D for dyspnea or difficulty breathing, as the backup to the lungs causes pulmonary hypertension and affects gaseous exchange in the lungs. Other signs and symptoms could be hypoperfusion due to the greatly reduced cardiac output, including skin looking cool, diaphoretic, pale or dusky, weak pulses, slow cup refill. So remember, stiff aortic valve, less blood is being pushed out, and then so you have less cardiac output. The nurse will also auscultate a harsh systolic murmur heard at the second intercostal space, right sternal border. Again, use the mnemonic ape to man to figure out where you should put your stethoscope. Let me drink some water, hydrate. Aortic regurgitation. So now the aortic valve is leaky. Does not close completely during diastole when the ventricles relax. And during this time of diastole, the aortic valve is expected to close completely so that it can catch blood and prevent it from moving back into the left ventricle. Some of the blood it catches flows into the right and left main coronary artery to perfuse the heart muscles. So exam question here, very good exam question. When does the heart muscle get perfused? Is it during systole or diastole? It's during diastole. Don't forget that. So moving on. During diastole, as the ventricles begin to rest, the aortic valve is expected to close so that the blood gets collected and distributed to the coronary arteries and the rest of the body. However, with a leaky aortic valve, more blood returns to the left ventricle, and that means the stroke volume and the cardiac output will be greatly reduced. So, at this point, we are in diastole, right? The left ventricle is being filled by left atrium and also the backflow from the leaky aortic valve. That's too much blood volume for the left ventricle to handle. So, because the left ventricle is not able to handle this so much blood volume, it therefore compensates by dilating. The muscles stretch like a balloon to accommodate more blood volume. Too much stretch, too much of everything is bad. So, the left ventricle muscles weaken over time. And it says, you know what, I'm tired, can't do this anymore. This means it pumps less blood out. Basically, we are now talking about left ventricular failure. So then, blood backs up to the left atrium and eventually to the lungs, causing pulmonary edema, crackles, and difficulty breathing. Additionally, remember that less stroke volume means less cardiac output and less available to the rest of the body. So you might see signs and symptoms of hypotension or hypoperfusion. The nurse should locate the aortic valve at the second intercostal space, right sternal border. You will hear a high-pitched blowing murmur.